Hey girl, hey. Welcome back to my channel. Welcome to my channel if it's your first time here, living life with Aisha Amina. I am Aisha Amina, and I'm going to talk to you about vaginal yeast infection. I'm assuming if you're watching this, for the most part, you have a vagina. If you have a vagina, this video is meant for you. Let me start off by saying that I am by no way, shape, or form a healthcare professional. Always consult with your doctor. Take what I'm saying, I want to say with a grain of salt. This is my experiences, friends, family, just reading, visiting doctors, just a compilation of all of that I'm sharing with you. Do not diagnose yourself off of this video. That's my little disclaimer. Moving on. What is a yeast infection? Well, if you have a vagina, we all have small amounts of yeast that live inside there. Along with that are natural occurring bacteria. So once when the pH in the bacteria has been compromised, the yeast will take over. The yeast will be having a party in your vagina, in which is when you will experience the symptoms, which I will get into. Let me just say that if you do have a yeast infection, you've had a yeast infection, that doesn't mean you got a stink ass coochie or anything like that. It is it's normal. About 75% of women get a yeast infection. So if you were that 25% that's never experienced it, you are lucky. You were lucky. I hope that you never experience it because it can be very uncomfortable. Very small amount, like it's very rare that men can get a yeast infection, but it is possible. No, yeast infection is not considered to be an STD or an STI, a sexually transmitted disease or infection, but through certain activities, which again I'll get into, you can contract a yeast infection, and it is curable. It's curable. It's not that serious. It's only the only reason why it's serious because it can become very uncomfortable. What are the causes of a yeast infection? Well, let's just, again, get an understanding that it naturally occurs or it naturally exists in our vagina, and it's an overgrowth of yeasts. Our normal bacteria that's in our vagina keeps the yeast under control. So one of the main causes is taking antibiotics. It's killing off the good bacteria, which causing the yeast to come out and play and having to take over in your vagina. So just know that that can occur, and most doctors will let you know to keep a lookout, or sometimes they'll even give you medication for yeast control paired with antibacteria or antibiotics because it's that common. Pregnancy. That's another cause. And there's nothing really you can do about that. And the reason why is because the levels of your hormones and estrogen can disrupt things. Anal sex. This is not something that I personally have experienced, but it has happened where it's the same concept of wiping front to back. You never want to do it the other way around where you're getting poop particles all up in your vagina. Think about that. It's not good. So when you are, or your partner is going in the back door and then going into the front door, yeah, you're gonna have some problems. And that is the only time where it is sexually transmitted because of your activities. So be careful. What are some of the symptoms of a yeast infection? Most people know the number one symptom is itching. It is very uncomfortable. It is very uncomfortable. If you experience it before, you know exactly what I'm talking about. And the longer you go without it being treated, it only gets worse. If you had it before, as soon as you start getting that little tingly feeling, you know what time it is. Take care. Soreness. Soreness and burning between going to the bathroom and when you're having sex and when you're wiping. You're going to feel that soreness. You're going to feel that itchiness. It is just very uncomfortable. You know, when you're in a shower, you're going to want to scratch the crap out of that. And it's going to be raw and it's going to be even more irritable. So as soon as you start to get some symptoms, go see the doctor, get that taken care of. Another symptom is discharge. You will have kind of like a milky white discharge, or sometimes it's clumpy, kind of like cottage cheese, and usually it doesn't have an odor. Another symptom. Again, go get it checked out. How do we prevent a yeast infection? How do you prevent a yeast infection? You can kind of guess from some of the causes. You want to make sure that you wipe front to back. If you take an antibiotic, just be mindful that a yeast infection could happen. See if you can get medication for it when you leave your doctor's office. Also, a lot of people don't know about wearing cotton underwear as opposed to nylon. You want to wear cotton underwear so that it wicks away that wetness, because that wetness is going to cause an unbalance up in there, an overgrowth of yeast. So you want to wear the cotton so it has a chance to evaporate. If you're sweaty, wherever the case is, change your underwear, put some fresh, dry underwear on. Same thing with the bathing suit, same concept. You don't want to wear it for a long period of time. Take it off, put something dry on. Douching. Don't be a douchebag and douche. No offense if you do. Maybe you don't know, because I didn't know. I was young and dumb at one point and was douching. I don't even know where I learned it from, why I was doing it, but my doctor told me not to do it, and I haven't done it since. I haven't had a problem. My doctor also told me not to use scented products, products with perfume, tampons, pads, feminine washes, certain powders, and even some people are really sensitive to scented soap. So just be mindful that can disrupt the pH that's going on in your vagina that can cause a yeast infection. Change your pads regularly. Your pads, your tampons, there's a max time that you should have it in, but you should change it more frequently, again, because that is wetness that is all up in your box. You want to make sure that you change it and keep it dry, kind of like a baby's butt. Keep it dry and clean and fresh. The last thing that helps prevent, some people may know, and whenever I consume this, I say that it is good for the vagina. Yogurt. Yogurt yogurt naturally has microbial substances up in there that will help add or whatever to the good bacteria that's in your vagina to help suppress, boom, boom, bow, that yeast that wants to take over and have a party in your vagina, causing all of those symptoms that I had listed before. So I don't like to eat yogurt, jello, pudding. I don't like things of those consistencies. But within the past couple of years, I definitely started eating it more. I keep it in my refrigerator, and it's very good to have a part of your diet. It's good for It's good for other things aside from keeping yeast in control. You should definitely keep yogurt on deck. Okay. How do you treat these little bastards? Well, it's a couple of things. First of all, you should always consult with your doctor. Like I said at the beginning of this video, I am not a professional. Consult with your doctor. If you had it before, you know what the symptoms are, you can go to Rite Aid, Walgreens, CVS, Walmart has it. You guessed it. You've seen it on commercials. Monistat. They got Monistat 1, Monistat 7. It's a suppository. It's basically cream that you are going to supposite into your vagina. Now, I'm going to give you a little 411. The 1 day versus the 7 day, they may have like the 5 day or something like that. A lot of women prefer the 1 day because it could be very messy. And the bad thing about the 1 day is that your medication needs to work over a certain amount of time. You don't want to give a big old dose because it's not going to be as effective. It's like taking an antibiotic over the course of usually it's 14 days, and that's why the doctor always tell you to make sure you take it for those whole 14 days. So Monistat 7, if you're going to do it over the counter, is the better way to go as opposed to Monistat 1. You don't want to take any medication, even Monistat, if you are pregnant. Always consult with your doctor. I think going to the doctor is the best way to go, because you go to the doctor, for sure you will find out if it is a yeast infection, because it could be a bacterial infection. You don't know. So if you take this over-the-counter medication and it doesn't work, then you need to definitely see a doctor. And what the doctor has, of course, is going to be better than over-the-counter. you have the option to take a pill, which is awesome. It works within at least 24 hours and it's not messy. And they also have suppository. So just so you know, this video was not to shame anybody. In fact, it's the opposite. Do not be ashamed if you have a yeast infection or any of the symptoms or anything like that. I don't want you walking around with itchy cooch, box, vagina, whatever you want to call it. Get it taken care of. Get it taken care of. It is very uncomfortable. You don't want to deal with that. And can I just add my own personal opinion, which it probably is true? Tight ass pants. Tight ass pants. I wear fitted pants, tight pants. A lot of the pants have stretch to them, but there are some people that are wearing pants where it's getting ready to bust out the seams. If I'm talking about you, you should probably retire those pants, okay? If you got camel toe, your cooch cannot breathe. It's not good. It's not good. And I'm going on the rant. I'm gonna leave that alone. Do your own research on that. But I want to thank you for watching. Thank you for tuning in. You know what I'm gonna ask you. Are you subscribed? Are you? If you're not subscribed, you need to go ahead and hit that subscribe button. How are you gonna know when new videos come out? You're not gonna know. Subscribe so you know when I upload new videos. Stay tuned until I see you again, or should I say till you see me again. Peace. Specifically to take off my makeup. So I'm just doing a demonstration of how well it works. And this is the brand that I have. Now do not come for me from my jar.